Very good evening to you all. My name is Ajok. I am the incoming country director for the Child's Eye Foundation. I'm very glad to be speaking to you today. I'm a public health specialist and have been predominantly working in child and adolescent health programming in Uganda. For the past 22 years, I've been working with an organization called the Straight Talk Foundation. It's an indigenous organization that's been operating for 25 years in the country. And at the time of my leaving Straight Talk Foundation, I held the position of executive director. But prior to being appointed executive director, I held several senior leadership positions, including serving as a programs director, grants management specialist, operations officer, and for the 22 years of my work in Straight Talk, I did quite a lot of work in the adolescent health area, working with the central government, the relevant government ministries such as the Ministry of Health, the Ministry of Education, the Ministry of Gender. I've also worked with a big portfolio of donors that include the UN, UNICEF and UNFPA, and several embassies, Embassy of Denmark, Embassy of Sweden, Embassy of Netherlands, and several private foundations who have funded and supported the work of the organization. So I have a lot of experience in partnership building, fundraising, resource mobilization, and particularly working with children and adolescents in the issues of sexual health, child protection, education, and many more. I have accepted the role of country director at Child's Eye Foundation for many reasons, but among them, Child's Eye Foundation is working with children, and their work aligns very well with the kind of work, with what I have done in working with children. It's a very senior leadership position, and I think it's going to give me opportunity to continue to grow as a female leader in the country, working on a very, very difficult agenda of child protection in Uganda. So I am looking forward to continuing to take on more challenges, especially in addressing child protection issues. There are many things I've liked so far already about the organization, but I think Child's Eye Foundation is working on a very, very bold strategy, and that is placing children in families and not in orphanages. I think for decades, we've always known that if you're a child without a parent, without a guardian, the best place for you is to find an orphanage for you where we can find caretakers for you and give you the fees, give you the clothes. But to begin to think about taking children away from orphanages and putting them in families, it's a very bold initiative that I think Child's Eye Foundation has championed in the country. And I don't think there are many organizations that have done that kind of work. So I think one, they stand out as very, very bold. Two, they've also set the pace for others to follow. Number three, I think they've also set the standards for others to learn from models like theirs that can be replicated and adapted to suit the different contexts. I think I also like the position because the space where Child's Eye is operating also links very well with all other areas that I've worked on, especially for children and youth. The issues of children transitioning into adulthood, we need to continue to support them. And I can see that I'll be applying a lot of my expertise in how we can support such children in families or those who are in care to transition in various ways, thinking about linking them to education, linking them to professional growth, linking them to many other things beyond just thinking about take you out of the orphanage and put you in a family. There's a lot more we can do with children to help them be productive. I am looking forward to, of course, growth personally and professionally. But one of the things I've been thinking about is that in this day and age, especially for children, we've been hit hard with COVID-19. And COVID-19 has been in the country, I think, since March. And it's impacted so many of the operations of organizations, of their funding, their partnerships, priorities, and all that. And for me, I think one of the things I'm really looking forward to is to see how we get to the drawing table and see how do we rethink probably what we've been doing. Are we still relevant? Are we responding well in times of COVID-19, especially for the child protection agenda in the country? COVID-19, I think, has also brought forward another bigger challenge of a crisis. I think, especially the child rights crisis. The issues of protection, access to education, access to shelter, access to food, access to so many things. We are hearing of hundreds and thousands of young people who have gotten pregnant. What's going to happen to them in the future? I think, it's really rethinking about how we can support the children that we are working with, support the children that we exist for, to continue to thrive and be productive in the future, irrespective of these challenges. So for me, that's where I'm looking forward to immerse myself once I commence the role in January. For me, the big picture that I have for the children of this country is a world where all children, irrespective of race, color, nationality, name it, where every child thrives to their best abilities. We know that children the world over, especially in developing countries such as Uganda, children face many, many challenges. But for me, my big dream is that all actors, as parents, as teachers, as caregivers, the government, civil society, we all begin to rethink the whole agenda for working with children. What should be our best interest? I think our best interest should be creating an environment where every child thrives to the best of their abilities. Whether I am living with disability, whether I'm HIV positive, whether I'm an orphan, whether my parents belong to which political party, at least my interest should be to allow every child to thrive to their best.